Hi and welcome to the Homeopathy Health Show. I'm Atiq Ahmed Bhatti, a fourth generation homeopath with over 25 years of professional experience and practice in this field of healing. The Homeopathy Health Show is the online voice of homeopathy around the world, promoting and raising awareness of this truly unique system of healing, which is suitable for all ages, young and old. Every week I invite guests from the world of homeopathy to come and share their experiences, their work, offer insights, and essentially talk all things homeopathy. Why not visit www.liketreatslike.co.uk and click on the radio and podcast button to listen to the latest episodes. So let's begin today's show here on UK Health Radio, the world's #1 talk health radio. Hi everybody, I do hope you're well. Well, first off, a very happy and blessed new year to you. And indeed, I wish you actually a very happy and blessed homeopathic new year. 2024 is going to be an amazing year for homeopathy, and you can find out more from my reels. I have certainly shared my views and my hopes and my desires on my Instagram account at like_treatslike. So that's where you can find me, which is at like_treatslike on Instagram. Please do follow and subscribe to the podcast. I do hope you're enjoying it. Thank you to the over 50,000 listeners. Truly, truly grateful to you. And please do note that the podcast is available on all the podcast platforms. All you have to do is just search for Homeopathy Health or even my name, Atiq Ahmed Bhatti. But generally, Homeopathy Health with Atiq Ahmed Bhatti works just as well. And you can also listen to this podcast and all the previous episodes on all the other social media platforms as well, including YouTube, including my website, which is www.liketreatslike.co.uk, at ukhealthradio.com, and of course on the Podbean app, which is podbean.com, and you can search for Homeopathy Health there, and I should be on the top spot. So, let's get on with today's episode, which is all to do with service to humanity. And I'm delighted to welcome my guest for today's episode, which is episode 56 of the Homeopathy Health Show, and that is Rebecca Stirrup, who is the president of the New Zealand Homeopathic Society, but also volunteers at Homeopathy for Health in Africa in Tanzania. Now, Rebecca does an amazing amount of work as far as Homeopathy for Health in Africa is concerned. And I'm really, really thrilled that I managed to get her on the show, on the podcast. Hey, what a way to start the new year. Amazing. So let's introduce my guest for today, Rebecca Stirrup. Thank you so much. I know you've been pretty much quite busy across the UK, certainly, with commitments and some very favourable times, I think. If I look at your Instagram stories, they've been very enjoyable to watch and see.
Yes, I have. I've had a marvellous time. I've been here since the beginning of June, and I'm actually English, and I've lived in New Zealand for 36 years, but I come back very regularly. My mother lives here, and I've got loads of friends still, all my old school friends. So I've been travelling around visiting people, which has been great. And I've even been across to the continent, to France and Croatia, to catch up with old friends as well. So, yeah, I've been having a marvellous time.
You have a lot of friends, because I'm I have been following your Insta stories. I must say I love them. They're really good because they're so happy. They're so happy, the pictures, and they're very bubbly, which is, of course, are great things about you as well as an individual, of course. But I just think they're really, really good, and very, very inspiring.
Oh, well, thank you. Yes, I do have. I'm lucky to have friends all over the world, I suppose, because I am a bit of a traveller. Started off in England, went to Africa actually when I was in my 20s. Met my New Zealand partner. That's how I ended up in New Zealand.
Oh, I see.
So that was my journey, and I never intended to go and live there for so long. I didn't imagine that it would be, but it has. Is that I've been there 36 years. So, but I still as I say, come back here regularly to England. But I trained in New Zealand as well when I was in my late 20s as a homeopath. So that, that was the start of my homeopathic journey, if you like.
Now, as far as I'm aware, I've never been to New Zealand, of course, but having had Tanya Aroha Twentyman, who's off Waiheke Island on New Zealand, on the show, and also Tracy Simpson, who's the owner of Homeopathic Farm Services and, looks after dairy cows and uses homeopathy. I know that it's absolutely stunning because from time to time I ask them to share pictures. So what's life actually like in New Zealand? What's it like?
Well, it is a very, it's a pretty beautiful country. It's a long, thin country, so we've got a big variety of climates. I'm in the north, which is subtropical climate in Auckland. And then further south, when you go right down to the bottom, you've got skiing and mountains. And coast is everywhere because, as I said, it's a long, thin country. So yeah, it's pretty good, pretty good life. And obviously not as, we're only 5 million people. When I arrived, there were only 3 million people. That was 36 years ago. And it always used to be the joke that there was many more sheep than people. But, people are starting to, there's been a lot of immigration in the last 20
That's Tracy's fault, isn't it?
Yeah, that's Tracy's fault, yes. And, I only live about an hour from where Tanya is. And I'm sort of halfway between Tanya and where Tracy is in the Waikato, which is a big farming area. So I also live rurally, but I'm only about half an hour outside of Auckland.
And it is so beautiful. I mean, I have, of course, like I said, I haven't been there, and we only see pictures or videos and or reels even. But it really looks like a calm place, a calm place to be in, very different from perhaps where you are now, as far as the UK is concerned.
It is, although I've been visiting a lot of rural areas where my friends live, and in fact, I absolutely love it here as well. So I think I balance it out between. I mean, it's winter in New Zealand, so I've done pretty well to leave because it's done nothing but rain since June and July, August. But it is a really beautiful country, and I think people are very outdoorsy in New Zealand, and I think people love the outdoors. There's less of those big city type stuff to do, so people are very hooked into beach, playing sport, all that kind of stuff. People are very much cycling outdoors, mountain biking. The mountain biking is terrific, so there's all sorts of that kind of stuff to do.
That type of environment is so good, isn't it, for the mind, body, and spirit? Because even though, perhaps it's not like the UK where you are now or other places where perhaps you want to spend time, but being in a relatively calming environment, or an environment where, there's lots of, you're not short of trees, and luscious growth and the beauty of nature.
Yes.
That's got to be good for you, right?
Oh, I think it really is very good for the soul. And I mean, I'm quite an outdoorsy person. I love to do that kind of thing. So, I mean, one of our regular things is I go for a bike ride once a week with one of my homeopathic colleagues and friends. And we ride our mountain bikes along the coast and up over the hills, but we chat nonstop about homeopathy and cases and what's happening in New Zealand. So it's a nice combination because I think it clears your mind, and we solve a lot of problems when we're doing that. Yeah, it's great.
That's actually so true. What you've said there is really important about problem solving. I've said it to so many guests on the show, and generally when we talk, that even if you go out for a walk sometimes to clear your head, but you think differently, don't you, when you're out, when you're going for a walk, or you're amongst nature as such, and you're surrounded by nature, for a better word. And the mind sort of is able to relax, and you're actually able to make good, positive decisions. And I, personally, I love that process. I think it's so proactive to be able to do that. Sometimes you're fed up, aren't you? And you think, oh my God, I don't know what decision to make and where I'm going to move forward, or whatever it is in life. You go out for a walk or a stroll, or you spend half a day in a park or whatever, and you're actually quite focused afterwards, and you think, okay, this is how I want to do it, and this is why.
Yeah, you're absolutely right. That's so true. And I suppose that I love doing that too. I'm somebody who has to do some exercise every day, take the dog for a walk, and it, as you say, it clears your head, particularly if you're sitting in front of a computer or on Zoom quite a lot. Then it's nice to have that counterbalance, I suppose.
I've had that kind of day. That's why my mug of tea is so big. I've been in front of Zoom all day, and it's fried my brain cells. So if I skip a question, please excuse me. I was going to ask you, Rebecca, that 36 years, of course, in New Zealand, and you trained as a homeopath in New Zealand as well, qualifying in 1994. Was that something you wanted to do as far as homeopathy was concerned, or was this just something that entered your life later on?
It was something that entered my life later on. I had my daughter when in my late 20s, and she had a little bit of eczema. I mean, I think this is often how many of us come to homeopathy. She had a little bit of eczema, and I remember my brother had bad eczema as a child, and I thought, oh, I don't want to go down that route of those medicines and things. What else can I do? And a friend suggested homeopathy, so I took my daughter to a homeopath. That was my first introduction. And then after that, I was in the computer industry, actually, completely different. And I I was at a bit of a crossroads, and I thought, I want to change. And somebody suggested, why don't you do, well, the friend suggested, why don't you consider homeopathy? When it was completely out of the blue. I'd never considered that before. So I did some investigation, eventually went along to the first lecture at the beginning of the year. And I thought, I'll just go and see and listen. And I was completely hooked within an hour or so. And I've never looked back, really. That was it. So it's been fantastic, but it wasn't a planned thing. It was really quite spontaneous.
What took your fancy as such, as far as, you mentioned it, you as soon as you were introduced, it was like, yes, this is what I want to do. But what was it, something in particular, or was it just the whole story of homeopathy and what it can do for you?
I think it was that, but I think it's also that it's so all encompassing that it's just so fascinating that it's the mind, the body, the emotions. And, even within the first couple of hours, I could really get that feel of how different it was, and how it incorporated absolutely every aspect of life and our universe, I suppose, even the remedies coming from nature or whatever. So it was that just, really blew my mind, I suppose.
You're so correct, because I get a lot of doctors, actually, medical doctors, GPs and consultants who come for homeopathic treatment. And when we get talking, I talk about homeopathy, and I always ask, of course, because you're looking at a case and you talk about mentals and emotions. And at first there's always a frown. Well, why are you asking me something like this? But it's fascinating. I mean, just today I was speaking to somebody, and I asked certain questions, and it was anatomy or state. And, he paused and he said, why did you ask me that? I said, well, because of this, this, and this. And he said, it's so correct. But they're taken aback. People are taken aback. And because I don't think any other system really goes into so much detail as homeopathy, as far as the profiling of a patient at that current state that they're in, but then to be able to go back many years, sometimes to birth, even sometimes to the mother or the grandfather or the grandparents, rather. It's just fascinating, isn't it? That whole journey is a journey of healing in itself, isn't it?
It is, yeah. And I think that's what my patients still love, when they come to homeopathy new, they've sort of got a little bit of an idea, but they don't really know what's going to happen in the consultation. And some people are a bit even nervous, but most people actually really enjoy it. And I just saw a new child today, and the mum is just so thrilled that I'm actually paying attention to what is happening to her child. So I think people really appreciate that, and they really value it. And, that in itself is fantastic.
You hit the nail on the head when you said that, the parents thanked you, because even, again, just recently, I had somebody, and the patient was quite, let's say, a nux vomica type, and very, got a very driven. got to do things, they've got to be done in a certain way. And I listened and listened, and at the end, it was so humbling for them to say, "Oh, thank you for listening."
Mm.
And that was 50% of the cure, I promise you, because you could see the change in that patient, whereas they were very serious and very assertive. All of a sudden, they'd become laughing, a bit more relaxed. And I could see that. And I thought, oh, how nice of them to say that, number one. But it wasn't anything to do with me. It was homeopathy, right? It was the practice. It was the process that's followed. And it's a win-win, right? It's a winner.
Mm. Absolutely, it is. And, that's... Yeah, and I enjoy that whole process still after all these years. I still enjoy listening to the story. I mean, I feel very privileged to hear all the different stories that my patients tell me. And and then it helps you to guide you to as good a remedy as you can find for that particular situation.
Absolutely. Now, Rebecca, you're full of surprises, very good, wonderful surprises, which include an English literature degree. So being a homeopath, you also in between managed to do a literature degree. Now, Eng-Lit is not, the easiest of subjects. So what made you go down that route? Was that anything to do with the love of reading books, or was it something else?
I'm a huge reader, and I always have been right from childhood. The comment was, you've always got your nose in a book when I was young, and I'm probably still like that now.
You are, because your Instagram posts, and I'm following everybody, by the way, but I remember 3 pictures with books in them.
Yes.
So.
Oh, yes, that's my friend who's just written a book for young adults, they're fantastic. Love Like Your Heart's on Fire. Great title, isn't it?
It is.
Yes. So I took the book on holiday with me, and I said, I'm going to get me reading the book in different places, just for a bit of fun. But yes.
Well, at least I'm paying attention.
You are paying attention.
And I say to all my followers that when I look at your reels as well and your posts, I do the same thing.
Yeah.
I just don't sleep. That's all. That's the time I get, to be very observant about these things. So how was that anyway, Rebecca? How was your English degree, and how did you manage that, actually, to be honest, with everything else?
Well, I loved it. I probably stepped back a little bit from homeopathy, but I really enjoy, as I say, I'm a big reader, and I enjoy that whole looking, and I think it's sympathetic with homeopathy as well, because, you're diving in deep into a literary work and understanding, all the different motifs that are going through, or the analogy and the metaphor, and that is very relevant, I think, to how we work with homeopathy. So I think it enhances the way you think. That to me, English literature, again, is all encompassing. It encompasses all of human life and nature. And I love to read. I read from writers from all over the world. I love finding new writers I've read lots of Nigerian writers. I've just found a Tanzanian writer, Kenyan writer. So I read a lot of African writers who are writing in English, as well as from, India and all over the place. Pakistan, I've just read a novel by a Pakistan writer. So, it's, again, I think it's that aspect of, and I love Shakespeare. And I learned a lot about Shakespeare. I did it at school, but I hadn't done it really since. So it was really nice to come to Shakespeare as an adult. And of course, he's the consummate person with words, isn't he?
Absolutely. You said something very profound, which is the fact that reading literature changes the way you think. And I think that's so important. If we truly reflect upon that, just on its own, just what you've just said there, that's so true, because it makes you. There's so many skills, isn't it, that you learn. There's the use of language. There's a use of situations. There's a deeper understanding of things, and it doesn't matter what book it is. It's the fact that you're reading is probably the most important thing here, anyway. But it really does change you, and you start to think in a so much more improved way.
Yes.
And I think that's that's a great way of sort of improving oneself as well, because once it goes back to something so simple, isn't it, that they're words printed on paper, and there are billions of books, aren't there, around the world. But it's amazing that each book there's never a book where you won't learn something.
That's absolutely true. And I think the other thing is it allows you to step into somebody else's shoes, the characters or the culture or wherever. So you really get an understanding from another person's point of view. So I really enjoy that, understanding about other cultures and people.
Now, Rebecca, you've done something, or you are continuing to do something very commendable, very admirable, and very humbling, which is to serve with Homeopathy for Health in Africa, which was co-founded by Jeremy Sher, as everybody knows, from the Dynamist School in the UK, and also Camilla Sher, who's the president of the Finnish Society of Homeopaths. Camilla is coming back on the show very soon, as is Jeremy Sher, and they're going to be talking about their work at Homeopathy for Health in Africa. But Rebecca, you initially went in 2013, and you've been multiple times since. So how did you get introduced to that amazing, incredible work that's being done in Tanzania and other places further afield as far as Homeopathy for Health in Africa is concerned?
Well, I actually saw an article that Jeremy had written in I can't remember which publication it was. And we had just got our youngest child through school and off to university. And this was our chance to go and do some stuff again, do some traveling again. So I applied and spoke to Camilla and said, we're happy to come. And both my husband and I, we have some experience of Africa. So southern and east. So there was some synergy there. So she said, come. So I went my husband came as well. We went for 3 months initially. And as soon as we got there, we bought a car so that we could get around, and we wanted to do some safaris with the idea of selling it. We kind of realized within a month that this just wasn't going to be a once in a lifetime trip. It was going to be, we were going to have to come back because I really enjoyed the work. We enjoyed doing some safaris, meeting all the local people. And that's when it's interesting because when I got there was this link with my English literature degree, because when Jeremy saw my CV, he said, she's got an English literature degree, let's get her, because he was just in the process of rewriting. Well, he was writing, obviously, numerous books, but he needed some help with editing. So that's how he gave me a tester to do a sort of a second introduction for his book to syphilis. And then I went on to edit other books of his as well, Neon and Argon and what have you. So it was kind of a nice joining of my English and my writing and reading alongside the homeopathy. Yeah. So it all worked out really well. And I was just hooked instantly, and yes, made lots of friends there and that kind of thing.
That's a wonderful introduction, isn't it? And it's nice that you had something there that was immediately applicable as far as that the English literature degree.
Yeah.
And so, what was it like then? What was when you first went there? What did you experience? What was it like going there first time and seeing everything in action as such?
As such, yeah. Well, we pretty much it was. I mean, obviously, I'd had some experiences as a homeopath already, but it's very different when you're plunged into those outreach clinics and you've got a queue of people waiting outside the little room that you might be sitting in, or the veranda, or somebody's compound on a little stool, and there's no kind of, okay, I can take an hour and a half case and go away and think about it and revise and then come back with an answer in 2 days' time or even tomorrow. You have to sit with the patient for as long as it takes until you think you know which remedy you want to prescribe. So sometimes that's 20 minutes. Sometimes it's half an hour if you're dragging your feet a little bit, or sometimes you can see in 10 minutes, that you need mercurius or whatever. So that was a completely sort of different experience. And the other thing I really enjoyed was working collaboratively in a group of homeopaths, so that we would, often we'd have a translator, maybe 2 homeopaths. We'd have a trainee homeopath who was making remedies. So there's a whole team thing. So yes, you're focused on the case in front of you, repertorising, working through a translator, which does give you a little bit more time to do all of those things, because they've got that little bit of a delay. But then afterwards, going back from the clinics, we'd be talking, about cases and, reviewing what we'd decided and, thinking about it, discussing new remedies or the pathology that we'd been seeing. So absolutely fascinating. Yeah, loved it.
It can be quite daunting. I know, because I've seen my late uncle, who was from Parklands in Nairobi. My siblings are from East Africa.
Yes.
So, and I remember going there, and of course he was a homeopath, and it's amazing to see that and to have experienced it as well. And it's so busy, and people are coming really quickly, and they don't want to wait, like you've correctly said. They want to remedy because for various reasons. One is they're suffering, and perhaps they can't actually make that journey again, even down to that.
That's exactly it. They're there for that day. They can't. They might have travelled. They might have walked 5 kilometers to get to you, or even further. So you've got to actually get the remedy there and decide on the spot. And I think the other thing which was interesting, is the way HHA, Homeopathy for Health in Africa, dispenses remedies. So generally we give out 12C potency in a bottle that's kind of designed to last a month, and they just take a capful or quarter capful a day. And that's very different from, say, maybe giving one dose of a 200 or whatever. So in general, we don't give the high potencies. And that was really decided because a lot of the patients were AIDS patients and quite weak. So you don't want to, little and often was a really good way of doing it. And also it kept people connected with the fact that they were taking a homeopathic remedy.
And that's so important as well, isn't it? Because we live in this... we live in times where perhaps medicines, let's say, have to be taken 3 times a day or even once a day, but it's stuck every day. And then here we are on one side also saying, well, you need to take a single dose and come back in 3 weeks or something, or a month. And people just give you that look, don't they? What? And the globules are so small anyway, or the tablets, or whatever form factor it is, But that's good, and it's a very physical potency anyway. So
it is a very physical potency, and they're all taught to succuss it in between, to give it a good shake every day before they take it. So it's just getting a little bit of energy, and I think it does connect people with that fact that they're taking taking a homeopathic remedy.
Now, you've done a lot of teaching as well, in Kenya in 2013, Malawi in 2014, and also ongoing.
We've got a group of 12 or 13 people who started learning homeopathy maybe 7 or 8 years ago now. So they're very good at prescribing. What happens is that we go to the Maasai. We were running, HHA runs a clinic maybe every couple of months. It's very remote. It's a big drive in, dust and Land Cruisers, and hard to get there. There's hardly any kind of healthcare there. So they're really pleased to see us. But then we're not there for 2 months, and so it's hard for people to get connected. And there's some villages we can't get to. So we started a small group, just training them on 12 basic remedies initially, and then gave them a little remedy kit. So we had a week's course, and we did, it's really fun. I mean, I did a lot I sort of learned how to teach in Malawi, the way we teach it, because again, I'm teaching in a foreign language, and I sort of forget that I'm not actually talking directly to them because it goes through a translator. So we use a lot of role play, and it works really well. One person will be the patient, somebody else will be the homeopath, and then the person, you give them a little scenario. Okay, somebody comes in with a sore throat and they're drinking cold water or whatever it is, or they limp in with an injury, and then it's just such a great way to teach people in a kind of a barefoot homeopathy way, if you like, or a grassroots level. And those people then, every time we do regular updates, and we've expanded that, they're now up to at least 50, 60, 70 remedies that they know really well. They can treat a whole range of issues without having to wait for us to come. And they might phone our headquarters every so often for a bit of advice or to run through a case. But in fact, they can do, and it means that we're spreading the word so much wider about homeopathy and reaching more people than we could otherwise.
It's so important, this role play. I find that fascinating because visuals last a lot longer. And, because it's so visual and it's so interactive that, that they're so easily able to then replicate that and show others. And education, from an education point of view, I think that's amazing. That's actually really spot on way of doing things, isn't it? I mean,
yeah, it was really, it's really, and it's fun too. We had a lot of laughs. And as I said, even they speak a little bit of English and I speak a little bit of Swahili. I don't speak any Maasai. But somehow you can communicate through your body language and enthusiasm, and, they've become friends, which is really nice. So those people, I know them well.
Oh, amazing. I think I only know Mimi Nataka Kulu in Swahili,
Oh, well, you might know Habari and Missouri. And funnily enough, my Swahili is, I know all the parts of the body. I know what vertigo is. Kazungu Zungu is vertigo. I know what dreams are, ndoto. I know what stomach is. I know what kafua and cough and cold. But I don't know. I can't speak Swahili, but I've listened to it so much when I'm hearing from patients that, I know what they're talking about, even though, because I know enough words. I know what hot and cold is, and their baridi or their whatever. So it's funny.
My mother was very fluent in Swahili.
Oh, right.
And but I wish I'd learnt off her now, but I was too young. So, now is probably the age I'd probably actually want to learn anyway. But, you as far as the training is concerned, and so does HHA equip the remedies, of course, to them so that they can carry on these clinics? And
yes, we do. So, Helios have been amazing. We started with a little 36 Helios kit, the 36 remedy kit. We did 12 first, and then we extended. That was our goal, is to cover all of those remedies, those basic remedies. And then as we teach new remedies, we give them all those new remedies as well. So they've got quite decent kits there. And then we're there every 6 weeks or 8 weeks. So as long as if it's not the rainy season, so we can top up any remedies as needed, which is great. But that's absolutely necessary. I also got them Fartax repertory, and I forgot that they don't speak English or read English. I don't know how I forgot that, but I did.
How did that go down then?
Well, they've still got them, and of course they've started, like me, they're starting to know the word for tumbo is stomach, for example, so they can do a little bit of translation now. But yes, that was a big mistake. There's no Swahili repertory, unfortunately, because they would have really benefited from that.
It's as you were saying that, and we're talking about this, but it's almost homeopathy is really comes into its prime and element with situations that you've just explained, and the work that HHA are doing, and the fact that you're going to Malawi or the Masai tribal lands and teaching, and because you're empowering those who actually don't have any facility for medicine or medical care, and they're able to look after themselves as best as they can, but also it removes that that anxiety that goes with being unwell.
Yes.
At least they're aware that, okay, well, this is what and this is what I need to do, and this is what I need to take, and this is the frequency or the dosage and potency, whatnot. And that's so important for them and for their children and for the generations that follow.
It is. It's very, very, very important. And I saw that particularly in Malawi, and where people would walk in with a sick child. That was one of the reasons that they were teaching homeopathic assistants out in the villages that might be 30 miles away or 30 kilometers away. And people would come in carrying a sick child, but it's almost, by the time they've carried them that far, there's no transport at all. I mean, in Tanzania, there is a little bit more transport available. But a child can die of malaria if they have to wait. They wait a little bit too long because it's so far, and then they've got to carry them walking. And it was really humbling to see. So that's where having people out in their villages that can do some first line of support is really, really brilliant.
It's amazing, isn't it, that when when, as we as we take that example, that if our child is sick, generally, let's say, not from a homeopathic perspective, generally, I'm saying,
Yes.
is a panic, isn't it? That, oh, something's wrong and it's a fever and it's 101 and blah, 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 and what goes with that. And yet these people are so strong-willed and very calm at the same time, that they will carry their child for as long as it takes. And it's literally, it's very emotional even saying it, but it's backbreaking to walk miles with, 10, 15 kilo, literally, or even more. And they're so persistent and they're so committed, but they'll never complain. Those who perhaps are suffering, and that's a testament, isn't it, to them, I suppose. We should just, their humility, I think, is the first thing here, and the fact that they don't give up. They will do whatever they can, and then, of course, whatever prevails is good or bad, God forbid, but whatever prevails, they also deal with that. But it's very, I don't know, it's very difficult to put into words, but I think you understand where I'm going with this. It's emotionally, for me, just to talk about it, and having seen it as well, actually.
Well,
it's a lot, isn't it?
They want the best for their children despite poverty and a lack of resources, and those lack of resources, that is a huge problem in Tanzania. But people still want the best for their children. And so something like homeopathy, which is affordable, you have to have money in Tanzania to access any kind of health care. So, Homeopathy for Health in Africa as a charity is actually offering a service to people that they otherwise wouldn't have access to.
I think it's amazing what Camilla and Jeremy have done. And of course, people like yourself who will travel all the way from New Zealand and, they essentially just go there and serve humanity, because that's what it is, serving humanity. And what you're doing is extremely important. And never forget that. It is what you're doing is you are literally saving lives. And this can be nothing better than that.
No, it's fantastic. And I think, the other side of it, of course, because when you give, you also receive, but we also get the opportunity I get the opportunity to learn and treat things that I would never be able to do if I was in New Zealand treating patients. So my knowledge is increasing, and I think it helps keep homeopathy flourishing as well, because some of that knowledge, if you don't use it, if you don't see, I never see epilepsy, for example, in New Zealand, because everybody is medicated. But in Tanzania, you'll often see epilepsy and seizures. So you get to know all those remedies really well that are for that, whereas otherwise I would never use them. So it's also, I'm also benefiting. Do you know what I mean? And I think homeopathy is benefiting too. We're keeping that knowledge moving forward.
Absolutely. I was going to ask you now, with everything that you're doing, and that's a lot, you're also the president for the New Zealand Society, or for the New Zealand Homeopathic Society.
Yes.
How did that come about?
Well, that was in sort of 2019, and they needed some help. The Homeopathic Society is a public-facing organisation. So the goal is to promote homeopathy to the general public of New Zealand. That's the goal of the society. We also run a bookshop, which is all run by volunteers, and we sell, a reasonable amount of books every year. We actually surprising number of books, and of course they were struggling for volunteers. So I sort of put my hat. They asked at our annual conference, and I sort of said, well, what is it you need help with, and put my hand up. And we went along to the AGM, and I was actually elected onto the committee. But then the lady who was elected president decided she didn't want to do it, and so suddenly it was catapulted on me. Would I do it? So that's how it wasn't.
As fate would have it.
Again, it was a spontaneous thing. It wasn't like a planned thing. So yeah, we've done a lot of sort of reorganization over the last 3 years to sort of streamline things. And we did it in the nick of time, really, with COVID, because our bookshop was it was based in Auckland, and it relied on a volunteer going in every week to the orders would come in, and then somebody would have to go in and actually physically post them. So what we've done is move our bookshop to a fabulous organisation called Natropharm, which is a homeopathic pharmacy in New Zealand. And they had some spare space, and they offered to take our bookshop and post our books out for us, because they're posting remedies every day. And that has been amazing. So that has helped us to streamline what we've been doing. And yeah, we've just made a number of other changes as well. And now we've got a bit more money coming in. We're actually helping or funding homeopaths to teach homeopathy in their community. That's our big motivating thing. We need this sort of grassroots thing to take off. So getting homeopaths to teach in their local communities, and we will help fund them so that they're not just doing it on their own, and we can provide material and stuff. So that's, I mean, obviously we got a little bit delayed with lockdowns and stuff like that, but it's really taken off in the last year. Yeah, and our next phase, we've actually gone another phase again alongside the college, which is our teaching college, and the council, which is our professional body. We're all forming a new organisation called Homeopathy New Zealand, so that we've got a 3-in-1, if you like. We've got under the umbrella of Homeopathy New Zealand. So to the public, anybody who wants a question about homeopathy, they come to that one organisation. We all run our individual organisations underneath it, but it's sort of strength in unity, and so that we can actually make some inroads into informing people, because it's very hard to inform people about it's not an easy subject to explain. And then the other thing we're doing is some charitable clinics. And obviously this is based on my work in Tanzania, so that we can have a network of charitable clinics across New Zealand, because not everybody can afford to pay a private fee. Well, most people can't. And there's certainly plenty of poverty or people who cannot afford to pay to go and see a homeopath. So, yeah, we've already got 2 clinics semi up and running. So that's pretty exciting. Yeah.
That sounds really good. And I think that's such a great idea as well with Homeopathy New Zealand. And it actually will like you said, there's strength in numbers as well. But I think collectively, you'll get so much more done now, because, you're comprised, it's an umbrella, isn't it? And and of course, I'm sure that's going to grow now over the next few years.
Yes. Well, we had a retreat recently with about 20 homeopaths, and between us, I don't know, we worked out that we had sort of 400 and something hours of 400 and something years of experience between us all. So lots of very experienced homeopaths. And I think that collective energy, can revitalize, some of the situations we've had in the last 3 years, where we've had long lockdowns and people been working in isolation, have had to go onto Zoom rather than working in clinics, because, everything had to change. So I think this reconnecting is really, really valuable.
It sounds amazing. I was going to ask you how homeopathy is perceived in New Zealand. I've spoken to, of course, we mentioned Tanya and Tracy, and but what's your take on it? Is it healthy, or is it growing? Is it what's the status?
I think it's been through difficult times in the last 10, 15 years, but I think there is a resurgence, and people are turning to more natural approaches. And so I think we're in a rebuilding phase. And I mean, it's interesting. I live in South Auckland, and we have a lot of people who've come from India, Pakistan, and I have lots of patients from those people who've come, and they already know about homeopathy. So that's fantastic. So they are also helping and also South Africans. There's a lot of South Africans in New Zealand, and they are, they're used to homeopathy. So I think when people come from other countries, patients this I'm talking about, then that helps stimulate the growth of it. But it is definitely growing again in the last 2 years, I'd say. I hope we're poised with our new organisation that we can help to grow. We do need new homeopaths, of course. We need more people training, that's for sure, in the colleges.
I'm sure it's going to happen, and I think, like I said, with this umbrella organization now, I think it's gonna do so much better. And again, strength in numbers, and collectively, there's just different ideas, isn't it? And then you can actually move forward, and because you're doing it collectively, there's a big blessing in that, anyway, isn't there?
There really is, and it's that collaborative work. It's it's more fun, it's energizing and stimulating than just working on your own.
Rebecca, it's been an absolute delight. I've really loved your Instagram posts and
no pressure.
I was supposed to end the show there, but that was my closing statement. But I really enjoyed talking to you, and there's so much more. It's been a sheer delight having you on the show today. Thank you so much.
Thank you very much for allowing me to be on here. That's fantastic.
I can't wait to share this with everybody. It's going to be epic.
Thank you.
I do hope you've enjoyed this week's episode of the Homeopathy Health Show. Please do support the show by clicking follow on my socials. Remember, the more exposure the podcast receives, the better for homeopathy around the world. You can find me on Instagram by searching for @like_treatslike, and on both Facebook and TikTok by searching for @like_treatslike. So let's promote the voice of homeopathy on radio and podcast around the world together. Don't forget to visit me online at www.liketreatslike.co.uk and click on the radio and podcast tab. Here you'll be able to see all the guests that have joined me on the show so far. And of course, you can stream on demand the latest episode to your mobile, tablet or PC. Until next time, stay safe and take care.